Hi, my name is Kristi Putnam. I'm a nursing student at Maryville University, and this is my health assessment exam. I had to do an assessment for my health assessment class. I've asked my husband David to assist me with it. Before coming back, we recorded his height, his weight, his vital signs. We also did his long distance vision screening by the Snelling chart, and I had him empty his bladder. I'm going to start by looking at his head, his scalp, and his skin. His skin on his face, it's pink, it's symmetrical, it's free of any lesions, there's no changes in his pigmentation. When I look at his head and compare the facial features such as his palpebral fissures, his nasolabial folds, his ears, his nose, his mouth, they're all symmetrical, they're smooth, there's no deformities, the skull is normal cephalic, it's rounded, and it's symmetrical on both sides. I'm going to next palpate the scalp. When I palpate the scalp, I'm looking for any rashes, any nits, any lesions, any scaliness. I don't see any. I'm going to move the scalp. The scalp is freely movable. I'm going to palpate this hair. The hair is smooth. It's equally distributed. There's no areas of alopecia. I'm going to palpate the facial bones. Any tenderness?
No.
Okay. There's no tenderness with that. I'm going to check the TMJ joints. Open your mouth, close. There's no crepitus, no popping, no snapping, no locking. Any tenderness with that?
No.
Okay, I'm going to palpate the sinuses. Any tenderness?
No.
Okay, that was the maxillary and the frontal. Next, I'm going to do light sensation. I'm going to have you close your eyes. Tell me where you feel the cotton swab.
Left cheek. Chin.
Okay, his light sensation is intact. Next, I'm going to inspect the eyes, the eyebrows. The eyebrows are coarse, they're thick. They are symmetrical. They extend to the outer canthus of his eyes. I'm looking at the eyelids for any inversion and eversion. There's none noted. The eyelashes, they curve away from the globes bilaterally. There's no orbital, periorbital swelling, redness, tenderness noted on either side. No edema. I'm going to palpate the eyelids. Any tenderness?
No.
Okay, I don't feel any nodules. I don't feel any light pressure with that. There's no flakiness. There's no redness. There's no swelling at the eyelid margin. I'm going to inspect the sclera. Look at me. Okay, his sclera is white. It's translucent. I'm going to look at the conjunctiva. Look up for me. When I look at the conjunctiva, it's pink. It's without any erythema. There's no abnormal growth. There's no redness. There's no swelling. The lacrimal apparatus has no inflammation. It's got no redness, no swelling. The punch is clear. I'm going to palpate the lacrimal gland on both sides. There's no swelling noted. Any tenderness with that?
No.
Okay, I'm going to also do his near vision exam. I'm going to have you cover your right eye. Can you read that?
DEFPOTEC.
Next. Hi.
DEFPOTEC.
On both, okay. Now both open.
DEFPOTEC.
Okay, good. That's 20/20 vision. Next, I'm going to check his visual fields by confrontation. Cover your eye. Tell me when you can see my fingers.
Now. Now. Now.
Okay, switch eyes.
Now. Now. Now.
Good. His visual fields are full by confrontation. Next, I'm going to look at his pupils. His pupils are round. They're 3 millimeters bilaterally. They are regular. I'm going to check them for pupillary reaction, both directly and consensually. Shine them in. Good. They constrict bilaterally. Good. I'm going to check for accommodation. I want you to look at the wall, and I want you to look at my nose. Good. Okay, I'm going to check the red reflex here. Okay. What I'm going to have you do is look at the wall. Okay. I'm checking the red reflex. I see it. Switch to the other side. Okay. The red reflex is bright. It's intact. There's no silhouettes noted. Next, I'm going to check the 6 cardinal fields of gaze. I'm going to have you follow my pen. I'm looking for any eye movement, any nystagmus. Good. Keeping your head straight. You follow it. Good. Perfect. Okay, his eye movements are symmetrical and move through all 6 cardinal fields without any nystagmus noted. I'm going to do the cover test. I'm going to cover this eye. I want you to look ahead. Okay. What I'm looking for is any jumping or any abnormal movements of the uncovered eye, and there is none. The test is negative. I'm going to inspect the ears for alignment. The ears are in alignment. They're parallel with the outer canthus of the eyes. Bilaterally, they're symmetrical. I'm going to palpate the auricles for any masses, tenderness, or lesions. Any tenderness noted?
No.
Okay, I'm going to check the acoustic test for the acoustic nerve. Cover your right ear. I'm going to say a word.
Pink.
Okay, good. Cover the other ear.
Apple.
Good. No problems with whisper test. Next, I'm going to check bone connection. Tell me, can you hear it in both ears?
Yes.
Same. Okay. And now on the mastoid process, this is the Rennie test.
No.
Okay, we can no longer hear it.
No.
Okay, and on the other side, okay, I'm putting it on the mastoid bone.
No.
No longer hear it.
No.
Good. The air conduction is greater than the bone conduction bilaterally. I'm going to next inspect the ear canal on both sides. I'm checking for any lesions, any scaliness, torn body, and I'm looking at the tympanic membrane. Good. There's no lesions, there's no scaliness, there's no redness, there's no foreign bodies. The tympanic membranes are both pearly gray bilaterally. I can visualize the bony landmarks, and it's got a good light reflex bilaterally. Next, I'm going to look at the nose. I'm inspecting the nose just for alignment first. It's in alignment, it's symmetrical. The septum is midline. There's no deviations noted. The nares are oval in shape bilaterally. They're patent. There's no discharge. There's no flaring. There's no narrowing noted. I'm going to palpate the bridge. Good. Any tenderness?
No.
Okay. When I palpate, the nasal structures are firm. They're stable to palpation. There's no crepitus. There's no tenderness noted. I'm going to cover your right nair. Breathe in and out. Switch sides. Breathe in and out. Good. His nasal passages are patent bilaterally. I'm going to inspect the nasal mucosa on both sides. Okay. The nasal mucosa, it's pink, it's glistening, and there's no discharge, there's no masses, there's no lesions, there's no swelling of the terminates bilaterally. Next, I'm going to look at the nasal septum. It's intact, it's midline. There's no perforations, there's no bleeding, there's no crusting. Next, I'm going to inspect the lips. The lips are pink, they're symmetrical. There's no crusting, there's no fissures, there's no lesions noted. The mucous membranes, I'm looking. Okay, on both sides of the buccal membranes. They're pink, they're red, they're moist, and they're smooth. I'm going to check the gums now on both sides. Gums, okay. The gums are lightly stippled. They're pink, they're clear, they've got tight margins to the teeth on both sides. There's no swelling, there's no bleeding noted. I'm going to look at the hard palate. Good. The hard palate is dome-shaped. It's whitish. And then the soft palate is contiguous with the hard palate, but it's a little bit pinker. When I look at the, open your mouth one more time, okay? The anterior and the posterior pillars are both free and clear of any redness, erythema. There's no exudate. When I look at the uvula, it's midline. It's without any erythema, no swelling. When I look at the tonsils, they're +1. There's no exudate. The posterior pharynx is clear, it's glistening, it's pink. There's no mouth odor that I note. When I look at his teeth, there's 26 present. He's missing 2 on the lower left jaw, both the first and second molar. Otherwise, his teeth they're white and they're in different periods of repair. When I look at the dorsum of the tongue, stick your tongue out. It's dull red, glistening, it's moist. Move it from up and down, side to side. He's got full movement of his tongue. There's no deviations, no tremors. I'm going to have you put your tongue up, lift your tongue to the top. Okay, good. There's no, when I inspect the floor of the mouth and the ventral surface of the tongue, their veins are large. There's no redness, there's no swelling, there's no lesions, there's no plaquing, there's no erythema on it. I'm going to have you open your mouth again. Say ah. Good. There's good rise and fall of the uvula and the soft palate movement. I'm going to check the gag reflex. Good. His gag reflex is intact. Next, I'm going to move to the neck. The neck is smooth. I'm going to compare it from side to side. It's symmetrical. There's no carotid artery prominence. There's no jugular vein distension. There's no lumps. There's no fullness noted. I don't see the thyroid. Next, I'm going to have him do active range of motion. Move your head forward, backwards, from ear to shoulder, and then side to side. Okay, and then I'm going to shrug your shoulders. Okay, I'm going to repeat this with resistance forward, backwards, side to side, shrug your shoulders. Good. Okay, those are all intact. I'm going to check his carotid arteries next. I'm going to feel on both sides. Both. They're 2+, they're elastic bilaterally. I'm going to determine the tracheal position when I feel it's midline. I'm also going to check his thyroid. I'm going to, first when I look, I don't see it. Maybe swallow. I see movement. Next, I'm going to palpate it down. I'm going to feel on both sides. Okay. I'm going to displace the thyroid to the right, and I'm going to feel with my hand, my 3 fingers. Take swallow again. Good. Next, I'm going to displace it to the left and feel with my 3 fingers again. Swallow. Good. Okay. His thyroid is about 4 centimeters. It's wide. It's symmetrical, and it moves freely. There's no nodules. There's no masses. No tenderness noted. I'm going to palpate his lymph nodes, his occipital nodes, his occipital, his post-auricular, his preauricular, his tonsillar, his submandibular, his submental, and then I'm going to also palpate for his superficial cervical, his posterior cervical, his deep cervical, and then his supraclavicular. Good. Okay, I'm going to next auscultate his carotid arteries. I'm going to use the bell of the stethoscope. I'm listening for any bruits on both sides, and then on both sides of the lobes of the thyroid. There are no bruits. Next, I'm going to look at his upper extremities. When I look at them, they're symmetrical in size, shape, and contour. I'm looking at the hands. He's got 10 fingers. I'm going to palpate his interphalangeal joints for any tenderness. There are none. His metacarpal, his wrist, there's none. It's freely movable. His elbows are bilaterally symmetrical in length, circumference, contour, alignment, and muscle mass. Next, his shoulders. I'm looking at his shoulder girdle. I'm looking at the contour. I'm looking at his clavicles. I'm looking at his scapula. I'm looking at the surrounding muscles. All of them are symmetrical in size and contour. I'm going to palpate for any tenderness in the shoulders. Any tenderness noted?
No.
Okay. There is no tenderness noted. Okay. There's no masses. I didn't feel any lesions or any nodules. Next, the skin. I'm just looking at the skin. The skin is pink. It's uniform. It's with equal thickness. It's symmetrical. There's no rashes. There's no lesions. The temperature is warm. It's dry. Bilaterally, the texture is smooth and even on both sides. I'm going to check for turn mobility. When I pinch it, it moves back to place quickly. It's resilient. Next, I'm going to look at his nails. When I inspect his nails, the nails are pink. They're smooth. They're rounded. There's no jagged edges. There's no depressions. There's no pitting on either side. There's no peeling. Nail base angle is about 160 degrees. There's no clubbing noted. I'm going to inspect the proximal and the lateral folds of the nails. There's no redness. There's no swelling. There's no pain. There's no masses. There's no cysts. There's no warts. I look at the nail plate here. The nail plate is thick. It's not especially thick. It's not. There's no thinning noted. When I pinch it between my fingers, it's intact to the finger. It stays intact to the finger. Between it adheres well to the nail bed. Next, I'm going to palpate the brachial pulses on both sides. Okay, and then the radial pulses on both sides. Okay, both they're rounded in contour. The amplitude is +2 bilaterally. They're elastic. Next, I'm going to have you turn that way. I'm going to look at your back. When I look at his back, I'm looking for any cyanosis, any pallor. The skin is uniform in appearance. It's equal. It's symmetrical. There's no lumps. There's no masses. I'm going to look at the thoracic configuration. In doing so, I'm looking at his scapula. I'm looking at the spinous processes. I'm also looking at the scapular, the hemathorax of the scapula bilaterally. I'm looking at the transverse diameter versus the AP. The AP diameter is 1 to 2, which is normal. I'm going to palpate for any CVA tenderness. Do you feel any?
No.
Okay, I'm going to percuss on both sides. Any tenderness?
No.
Okay. Next, I'm going to look at the back for look at the lungs. I'm looking for breathing. He's breathing regular. There's no distress. His breath sound. His breathing is symmetrical. There's no accessory muscle use. There's no bulges. No masses. There's no retractions noted. I'm also going to palpate for thoracic expansion. I'm going to put my fingers at T10, taking a deep breath in and out. Okay, good. My thumbs move symmetrically. I'm going to palpate for tactile firmness. I'm going to have you say 99.
99, 99, 99, 99, 99.
Good. Firmness is symmetrical in all areas. Next, I'm going to percuss the posterior and the lateral aspects of his chest. I'm expecting to hear resonance on all sides. Okay. Resonance is heard over all his lung fields. I'm going to percuss for diaphragmatic chest excursion. I'm going to start by palpating down the diaphragm, the scapulary line, the left scapulary line. I'm going to have you exhale, taking a deep breath in, exhale, and hold it. And I'm going to keep palpating down until I feel a stop from, it goes from resonance to dullness, which is right here. You can go ahead and breathe normal. Okay. Next, I'm going to have you take in another deep breath in and hold it now. Okay, and here is where it changes to dullness again. And I'm going to measure the two on this side. The distance is about 3 centimeters, which is normal. His diaphragmatic chest excursion is about 3 centimeters. For time's sake, I should do it on the other side too, but I'm not going to do that. I'm going to auscultate both the posterior and the anterior and then the lateral surfaces of the lungs. Systematically. And come here, I'm going to have you turn around my way. Put your arm for me. Okay, good. Okay, his breath sounds are vesicular. I don't hear any adventitious sounds such as any rales, bronchi, or wheezing. Next, I'm going to look at the anterior chest. First, I'm inspecting for color and any venous patterns. It's pink. There's no superficial venous patterns. There's no supernumerary nipples. There's no scars noted. I'm looking at the symmetry. I'm comparing the clavicles, the sternum. The clavicles are symmetrical. The sternum is flat. I'm looking at the rib slope down. His respirations are about 16. They're even. They're non-labored. He's got no accessory muscle use. There's no bulging. When I look from the side, I'm looking for any pulsations, any heaves, any lifts. I don't see any. I'm going to now palpate the chest wall for any tenderness, any pain, any nodules, any deformities, any masses. Any noted? Do you feel any tenderness?
No.
Okay, next I'm going to palpate the precordium. I'm going to start over at the apex. I'm feeling for any thrills, heaves, any pulsations. I'm going to move to the left sternal border, and then to the base, and then the right sternal border. I don't feel any. Next, I'm going to feel for the apical pulse. It's usually on the left at the 5th intercostal space at the mid-clavicular line. I can feel it there. This indicates that the heart's not enlarged. Next, I'm going to check for tactile firmness. Not say 99.
99, 99, 99, 99.
Okay,
99.
good. Next, I'm going to palpate the infraclavicular lymph nodes for swelling and matted lymph nodes. I don't feel any. And the axillary on both sides. Okay, I don't feel any. Next, I'm going to percuss systematically on the anterior chest, expecting to hear resonance. Okay, I hear resonance throughout all lung fields. I'm going to auscultate the breath sounds on the anterior surface again. Listen systematically. Good. Okay, the breath sounds are vesicular to all fields. There's no adventitious sounds heard. I'm going to next auscultate the heart sounds. I'm going to start with the diaphragm of my stethoscope. I'm listening first to the aortic. It's at the 2nd intercostal space on the right sternal border. Now I'm going to move to the 2nd intercostal space on the left sternal border. That's the pulmonic. And then just below that is Herb's. It's at their 3rd intercostal space on the left sternal border. And then the 4th intercostal space on the left sternal border is the tricuspid. And then I'm listening to the mitral and the apical at the 5th intercostal space, mid-clavicular line. Now, for time purposes, I'm not going to repeat it, but I would repeat all this with the bell of my stethoscope, listening for S2, S3, and any murmurs. The heart sounds are S1, S2. There's no S3, there's no S4, there's no gallops, no rubs, no murmurs. The rate is regular, and the rhythm's regular. Next, I'm going to have you lay down. Okay. I'm going to inspect your abdomen. I'm just looking at the skin first. The skin is pink. There's no lesions. There's no scars. There's no masses. I'm looking at the contour and the symmetry. It's rounded. The umbilicus is midline. Both sides are symmetrical. There's no masses. There's no bulges. There's no distension noted. Lift your head for me. Okay, good. Lay it back. What I was looking for was any masses, any hernia, any muscle separation. I didn't see that. As he lays his head back, I'm going to also observe the movement of his abdomen. And when he's breathing, I can note that he's got smooth, even movement with the breathing. I don't see any peristalsis. I also don't even see any aortic pulsation in the midline. There's none of that noted. I'm going to auscultate his bowel sounds to all 4 quadrants. Okay. His bowel sounds, they're nice, they're active, they're high-pitched to all 4 quadrants. Next thing I'm going to do is I'm going to also auscultate for bruits, for his aorta. I don't hear any bruits. Next, I am looking for I'm listening to his renal arteries for any bruits. And I don't hear any. And now the iliac. And now the femoral. There's no bruits noted. Next, I'm going to percuss for tones. I'm going to start systematically. Okay. The tones are tympanic over the epigastrum. They're resonant over the remainder of the abdomen. I'm going to next palpate the liver border. Where I'm going to start is I'm going to percuss up to an area from where I know it's tympanic, and I'm looking for a dullness. So I'm going to start here, and as I press up, okay, I feel dullness here, so I'm going to go ahead and mark that with a pen here. And then I'm going to go, now the upper border of the liver, I'm going to start and go down the chest wall, mid-clavicular, until I feel resonance to dullness. Again, I feel here. Okay, now I'm going to measure these 2. Okay, and it measures about 7.5 centimeters. Normal is about 6 to 12 centimeters. And when you write it and you want it to say mid-clavicular line, you always want to make sure. Next, I'm going to have you roll up on your right side, and I'm going to palpate. I'm going to percuss the spleen. I'm going to start percussing just posterior to the mid-axillary line. I'm going to percuss all around, and I'm looking for any dullness to the spleen, particularly in the 6th through the 9th intercostal space. Okay, you can go ahead and lay back. I don't hear any dullness to the spleen. Next, I'm going to perform light palpation to the abdomen, and I'm going to do circular round movements with the finger surfaces, palm of my hand. Don't want to go any deeper than 1 centimeter. Okay. The abdomen feels smooth. It's soft. There's no resistance. There's no tenderness, and there's no guarding. I'm going to do deep palpation now in all quadrants. Okay. I'm feeling for any masses, any tenderness, any pulsations. I don't feel any. I'm also going to feel the umbilical ring. The umbilical ring is round. It's soft. There's no bulges. There's no nodules. There's no granulation. I'm going to deeply palpate the right costal border. I'm going to try to push that forward and feel the liver. Okay. I don't feel the liver. And I'm going to deeply palpate over for the spleen on the left side. Okay. I don't feel it. While I'm over here, I'm going to palpate for the kidney. Okay. I don't feel the kidney either. Palpate for the kidney over here. Take a deep breath in. Hold it. Okay, now let it out. Okay, and I'm also going to palpate for the aorta. And I can feel the aorta. It's probably about 3 centimeters wide. Next, I'm going to test the abdomen, the muscles. What I'm going to do is, normally I'm going to stroke the side of the abdomen. And what I'm watching for, the muscles on the stroke side will contract, and the umbilicus will deviate in that direction. And as I do it, that does happen on both sides. So his muscle reflex is intact. Next, the feet and the legs. I'm going to inspect the color while he's laying here. They're pink, they're uniform, there's no areas, localized discoloration. I'm going to feel that the skin is in equal thickness. I'm going to feel for the temperature. The hair is equally distributed. The temperature is warm. I'm going to check for capillary refill on both sides. There is less than 2. I'm going to palpate while his muscle mass is they're both normal in size and contour. I'm going to palpate for his dorsalis pedis. Okay, and then his posterior tibialis, and then his popliteal. And I'm going to do that on the other side as well, dorsalis, posterior tibialis, and this popliteal. They're all +2. There's no edema, no swelling. His pulses are +2. They're rounded with equal contour. Okay, I'm going to have you sit up for me. Next, your nervous system, your cranial nerve 1, I tested, or actually I haven't tested. Do you have any problems with smell?
No.
Okay. Cranial nerve 2 is the optic nerve. It was already previously tested when I assessed his visual acuity. Cranial 3, 4, and 6, the ocular motor, the trochlear nerve abducens, were already tested when I did the 6 cardinal fields of gaze and the pupillary response. Cranial 5 is the trigeminal. I assessed that when I palpated his clenched jaw, and then the light sensation to his face. Cranial 7, I'm going to test real quick. That's his facial nerve. I'm going to have you wrinkle your forehead. Okay, I'm going to have you smile. I'm going to have you puff your cheeks. I'm going to have you clench your teeth, or show your teeth, clench your jaw, and squeeze your eyes shut. Now, cranial number 8 is the acoustic nerve we've already tested with hearing. Cranial and the Weber and Rhine test. Cranial 9 is the glossopharyngeal and the vagus nerve. I've already tested it when I tested your gag reflex and the movement of your palate, your soft palate. Your spinal accessory is number 11. I've already tested that when I had you do the shoulder shrug against force. And then 12 is the hypoglossal nerve, which was already previously tested when I had you open your mouth and stick out your tongue and check for any deviations. Next, I'm going to have you close your eyes, and I'm going to check for sensation with a cotton swab. This time it's going to be all over. I want you to tell me where you feel it.
Forehead, right arm, left arm, right leg, left leg.
Good. Next, I'm also going to check. I have you keep your eyes shut. Tell me if you feel sharp, smooth, and where.
Sharp left arm, smooth right arm, sharp left leg, smooth right leg, sharp left foot, smooth right.
Okay, good. Next, I'm going to check the joint position of your great toe. I'm going to have you tell me if it's up or down.
Up, up, down, up, down.
Perfect. Okay. Next, I'm going to check here. You can open your eyes. I'm going to check your reflexes. I'm going to check your brachial reflexes first on both sides. Good. Those are intact. I'm looking for the jumping movement. I'm going to check his patellar reflexes. They're intact. And then his Achilles. And they're intact. Okay, all of the reflexes are intact. They're +2. Next, I'm going to check muscle strength. I'm going to have you put your arms out at your side. I'm going to have you try to pull them down. Good. Push them up. Okay, now bring them into me. I'm going to have you bend the elbow. Try to pull to you. Good. Push away from you. Good. Then pull towards you, push away from you. Okay. Now I want you to squeeze my fingers. Okay. I want you to put your fingers out like that. Okay. Good. And pull your fingers apart too. Okay. Next, I'm going to look at your lower extremities. I'm going to have you pull your legs close to you. Okay. Now pull them away. Okay. Now I want you to try to lift them up. Good. Now lift them down. Good. I want you to flex your toes to you. Good. And now push away. Okay, on both sides, push your foot. Okay, push away. Okay, good. Your muscle strength is +5 against resistance. It's all intact. Next, I'm going to check your cervical spine. I'm checking for alignment, the curvature. It's the contour. It's concave. It's erect. It's in appropriate alignment. It's symmetrical. All the skin folds are symmetrical. I'm going to palpate the posterior neck for contour. The muscles have good tone. I'm going to have you go ahead and stand for me. I'm checking your thoracic and your lumbar spine next. I'm going to have you go ahead and bend over, touch your toes, okay? Okay, you can come up. What I was looking for was any kyphosis, any scoliosis, which is the lateral deviation, and I'm also looking for any lordosis, which is the sloping inward. I'm going to palpate along the spinous processes. Any tenderness?
No.
Paravertebral muscles? Any tenderness?
No.
Okay, I'm going to percuss. Any tenderness?
No.
Okay, what I want you to do is bend over. Okay, bend back. I want you backward all the way. I want you to go lateral bending on both sides. And then what I want you to do is twist backwards like that and twist backwards like that. Great. This concludes my head to toe exam. Thank you.